Hi, my name is Marissa Seaforth, and I'm going to complete my interview. Unfortunately, I'm by myself today, so I'm going to have to answer the question, ask the questions, and then answer the questions myself. So I'm going to go ahead and begin by answering each question one by one. First question is, one, briefly tell me about yourself. Well, first of all, my name is Marissa Seaforth. I'm 43 years old. I am a kinesiology major at Cal Baptist University. I'm a senior there. I currently am hoping to graduate by next summertime, and at that point, I will apply to PA school. My future plans are to apply to the only 5 PA schools that are in Southern California and hopefully get accepted to one of those. Of course, my first choice will be California Baptist University. I also have 2 wonderful daughters. My oldest daughter's name is Tristan. She's almost 21 years old. She'll be a senior in college. She goes to Lindenwood University in Illinois. She plays softball there, and she's an athletic training major. Then I also have an 11-year-old who also plays travel softball. Her name's Evan. They're the light of my life, and I don't know where I would be in life without them. I'm a single mom, and I work hard. I work full time. I go to school and do my very best to take care of both of them as best as I can. My background, I came from the military. I was in the United States Navy for 22 years. I retired in March of 2015. I was an independent duty corpsman, and I retired as a senior chief, which is an E8. I did a lot of medical stuff. I was the equivalent on the enlisted side of what a PA does in the civilian sector. So naturally, that's why I've selected to be a PA, because I know exactly what I want to do. I love patient care. I love emergency medicine. I love treating patients. So being in that aspect where I can see a patient, I know what's going on with them, I can do my very best to help them out, and the end result is either referring them to a higher echelon of care or even fixing what they came in for, greatly satisfies me. So that's why I chose the position of physician's assistant. My next question is, why did you choose this profession? Again, I think I kind of answered that in my previous question. I chose this profession of physician's assistant because that is my background. Like I said, I was an independent duty corpsman in the Navy. Primarily, I want to say about 18 of those years of the 22 were served with the Fleet Marine Force. So many of my years were on the ground with the Marines, working in shock trauma platoons, different areas, going on convoys, going out with special forces units, doing anything and everything you could possibly think of with those Marines or special forces units. I got the opportunity to do. It was the best time of my life. I would never ever take away from any of that. It's formed me into the person that I am today. So treating patients is something that I am passionate about. More of my experience, like I previously explained, is in the emergency medicine aspect. So I don't necessarily feel like I need to stay in the emergency medicine side, although I do have a lot of clinical experience as well. So your typical people that come in with colds, flus, aches, pains, that kind of thing. I like seeing those things too. Like I said, I like either having the opportunity to refer them to something higher than what I'm capable of taking care of, or especially me being able to taking care of a patient from A to Z. When they come in, fixing their problem, and then them following up with me and say, hey, Marissa, everything you did for me worked really well. I'm feeling great. That's what I love. I love making people feel better. The third question is, what do you like most about your profession? What do I like most about my profession? I would honestly have to say being around people. I love being around people. Being alone and working, when I was in the Navy and they deemed the term independent duty corpsman. The word independent didn't necessarily mean I was alone. Independent meant that I could work and I could see patients and I could treat them from beginning to the end or refer them on independently by myself without the help of a doctor or a nurse. That's why I was trained. So that's where the word independent comes from. But I love being around people. I was around people every day, all day. I could talk to anybody, spark up a conversation. I love to tell my stories. If people want to know about my stories, I tell them about my stories. It's what makes me who I am today. Every experience that I had, every story that I have has made me into the woman that you see here right before you. So that's exactly why I want to be a PA. I want to, be around people. I want to work with a diverse group of people. I want to work with doctors. I want to work with nurses, possibly. I want to work with medical assistants, nursing assistants, whomever it is, wherever my job takes me. I want to be around people, especially sick people. I know I don't want to be sick myself, but I want those people to come in so that way I can take care of them. The next question would be, what do you like most about your profession? What do I like most about my profession? I like taking care of people and healing them. That is what I like best about it. I love being able to accurately screen, diagnose, and prescribe the right set of modalities for a patient, whether it be just a generalized cold or a flu. Or maybe somebody comes in with an abscess. I know that sounds gross, but whatever it is, something that I can fix, make them feel better, send them away happy, and then they come back and follow up with me and say, hey, I feel so much better. Thank you so much. That's what I want. Next question is, what is the most important characteristic of a company that you would want to work for? The most important characteristic, I would say, would be the staff. I would be walking into, whether it would be a clinic, whether it would be a hospital, whether it would be an urgent care facility, whatever it is, I'm a new person walking into an already established group of people. And what is most important to me is a great group of people. I want to be able to walk into there and mesh well with them, especially the doctor that I will be working under. I'm not sure if many of you know, but PAs work under the credentials of the doctor. So that would be the most important thing, is that doctor and I mesh really well together, and that doctor trusts me 100% that I can go and do the job set before me and make him proud and make his company money. Obviously, but that's what I would most say. I would, one of the main characteristics that I would look forward to in a company is the staff. Next question. What do you know about our organization? Like I said, I preferably would choose, if I were to choose on the right now, would probably be an urgent care clinic. And I would say an urgent care clinic because of the flexibility. Flexibility is very important for me. One, I've already retired from a career. Not that retirement is such a huge retirement that I don't have to work because I do need to work. Like I said, I'm a single mom. I have two girls still to take care of. I have a daughter in college. I have one that's still being raised. So these are things that I need to take care of, and I want to ensure financial stability for myself and my family. So flexibility is probably the number one important thing. I want to be able to take my daughter, my youngest one, to school, and I want to be able to pick her up. And then on the days that she's not with me and she is with her dad, then I can work longer hours, depending on my situation. So flexibility is my number one important thing. And I know urgent care clinics have that flexibility. They have physician's assistants that work weekends only, that work part-time, that work mornings, that work just in the evenings. There's 24-hour urgent care clinics that are open. So those are the ones that give you the most flexibility. I can work night times, I can work, night shift, whatever the case may be. I'm open to anything. So number one thing, flexibility. Next question. Tell me the main reason why you would want this job. Well, the main reason why I want this job is because I have a ton of experience in it. It's what I know. It's the only thing that I have known for, I want to say, the last 15 years. So it's something for me that is very naturally occurring. I love it. I've loved it from day one, and I think I love it till the day I die or retire from it. So that's the main reason why I want this job. Next question. Where do you want your career to go in the next 5 or 10 years? The next 5 or 10 years. Well, there are a lot of PAs that specialize in different areas. There are PAs that specialize in orthopedics. There's PAs that specialize in surgery. There's PAs that specialize in emergency medicine. Where I see myself in the next 5 to 10 years is, and maybe even sooner, is picking a specialty. I'm not quite sure what that specialty is right now, but I do see myself picking a specialty and going into that. I do know that might contradict a little bit with what I said earlier about the flexibility, but I am flexible when it comes to picking a specialty. Say I picked orthopedic medicine. Working with sports and people that come in with aches, pains, whatever the case may be, that's something that I'm very passionate about. Something that I've thought a lot about. So I know there's a ton of ortho PAs out there. Not necessarily saying that's where I need to be or where God's going to lead me, but I do see myself in the next 5 to 10 years picking a specialty, focusing on that, and then, mainly working as a PA in one of those sectors. So that's where I see myself in the next 5 to 10 years. The next question is, how would you describe your work ethic? I feel like I have a great work ethic. I have 22 years of military experience. I was inherently raised, like I said, around the Marine Corps life, where honesty, integrity, tradition is just the way of life. That's how it works. And those are skills that have been ingrained in me from day one. Being truthful, being honest, are other ones that are just personal things in me that I feel are intricate to this job as well. I feel like in addition to those things, I, have stability is good work ethic. I was retired from the military after 22 years. Not a whole ton of people can say they stayed in an organization like that for that long. 22 years is a long time. I left my home when I was 17 after I graduated high school and went to boot camp when I was 17, turned 18, and I never left. So I feel like being, stable and being committed to an organization for that amount of time is good work ethic and can be, a good asset for a company someday, especially if they're looking for somebody long term. Next question is, how would you describe your professionalism? Well, I would say I am extremely professional. Like I said, I retired as a senior chief. Not a lot of people can say that they retired from the military or in the Navy as an E7 or above. To get to the rank I was as a female, it took some hard work, true grit, and a lot of time. It took a lot of time away from my family, many deployments. I've made 4 deployments to Iraq, 2 to Afghanistan. I've put in all that time there. So back to the question, my professionalism is, I would say, is extremely high. I was able to lead and manage clinics with at least 40 corpsmen working underneath me. Other clinics of less, but I ran a clinic where there was at least 40 to 50 corpsmen going in all different directions, running ranges, running hikes for Marine Corps boot camp, running all different areas, and having to know where each and every one of those corpsmen are at any single time of the day, even when I wasn't at work, was something that I had to know. So I would say professionalism, I was always marked high on my evaluations when it came to professionalism. The next question is, what are some of the skills you were able to learn or improve on in your previous jobs? Some of the skills I would say I was able to learn and improve on. One that I can bring up that is most important to me is being humble. Just because you are high up on the totem pole doesn't mean you know everything. Means you know most, means you know a lot, but it's not the end all be all. One of the things that I can say that I take pride in is that I learned from my junior corpsmen. Not everything that was done in a clinic that I ran had to be done my way. There was always bigger, better ideas that a junior corpsman that could come up to me and say, hey, senior chief, I have this idea. Okay, let's roll with it. Let's try it. Let's see how it works out. Because guess what? That idea might be better than mine. And a lot of the times it was better than mine. So just because you as an individual are higher up in the food chain doesn't mean that you know it all. You can't micromanage your people. You have to allow them to do their jobs. You need to allow them to flourish because someday they're going to be you. So you have to duplicate yourself. And duplication is one of the things I feel is one of the most important things about that I learned and that I taught to them. So being humble and duplication. Next question. What would you consider to be your greatest strength? I would say my greatest strength is being personable. I felt like I was an easy individual to talk to. I love to sit down and talk to people. I love to hear their ideas. I love to hear their thoughts. I love to hear their problems, whatever the case may be. I'm very personable. When it comes to patient care, I could say that sitting down with a patient, all a patient wants from a provider is to be able to go in there and for them to just put their clipboard, their chart down, their pen, sit down and look at them and listen. Listen to what that patient has to say. Don't put your head down, write in the book or their chart while they're talking, blah, 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 fill out a prescription, hand it to them and be on their way. Listen to what they have to say. Listen to their signs or symptoms, what their ideas are. There's a lot of people out there that are Googling things about themselves in medicine nowadays. So sometimes you have to put those things at bay and tell them why, exactly why. Explain the differences between bacterial and viruses and why you don't treat viruses with antibiotics, things like that. So personable is one of my greatest assets. Last question. Why should we hire you and not somebody else that has similar qualifications? I would say the reason why I should be hired over anybody else is because of my past experience. I have 22 years of military experience. I have a great deal of leadership. I can teach people so many things. I'm willing to teach people. I want to teach people anything and everything that I know. I know that I don't know everything. So going to PA school is going to teach me things that I don't know. And those are things I want to pass down. I want to say, hey, MA so-and-so, come into the room with me. I want to show you how to do this. So that way they can learn how to do things. They might not be able to do everything that I might be certified or qualified to do or licensed to do, but at least they've seen it and they know how to do it and they can assist next time. Leadership, on the other hand, not a lot of companies out there have a lot of people that have leadership experience. I'm minor in leadership, so I've had the opportunity to take a couple of leadership classes that have taught me a lot of things about leadership traits that I already knew and that I didn't know, and knowing how to differentiate being the type of leader I was in the military and being the type of leader that you would need out in the civilian workforce. So that's what I say puts me ahead of another contender for this position. So that wraps up my interview. I would just want to say thank you for your time and effort today, and I look forward to future assignments. Thank you.